It's so long and complicated that it's hard for me to remember the details. My experience with my mom started about 10 years ago. Her diagnosis with multiple myeloma, which is a blood cancer. She went through extensive treatment for that, including a stem cell transplant, and was on maintenance therapy for the last decade, every month, chemotherapy and steroids. One day, she collapsed at home, and we rushed her to the emergency room to learn that she had had an aortic dissection. So she's one of the few people that even survived such a thing. About 6 months later, one day her foot turned blue, and she was in extreme pain. Rushed her to the ER. They called it blue toe syndrome. She was in the hospital for a week, discharged because she had slightly improved, and within 24 hours her foot turned blue again, even worse, back in the ER. And the doctors were completely puzzled. We had all these medical teams scratching their heads because nobody could figure out what was causing her foot to turn blue. And then one day, after a host of tests, they discovered there had been a large source of plaque in her aorta, linked possibly to the aorta dissection. So basically she was faced with a number of bad options. The bad options were, we need to replace your aorta, which might mean losing a kidney, her one remaining kidney, because she lost the other kidney during the dissection, and amputate your foot, possibly more. She called everybody in and said, I don't want to do this. I've lived a good life. I'm perfectly content. I am tired of being poked and prodded. I've been doing that for 10 years. And I'm good. Well, a lot of the doctors said, I hate to tell you this, but you're not dying. You're actually improving. And if we do these surgeries, you could have a quality of life to look forward to. We were very confused. We felt like we were getting mixed messages. She needed to have these surgeries, yet she wasn't dying, yet it was just, we didn't know what the right thing was to do. She actually sailed through the surgery, to our surprise. And then she develops a number of complications. And so begins the downward spiral and the vicious cycle that we ended up in of she would sort of improve, and then she'd be bounced back to the hospital with a complication that whatever setting she was in, they couldn't handle. So back in the ER, back into the hospital stay, teams coming through, scratching their heads. I'm not sure what's causing this. Her foot got even worse. So they ended up doing a partial foot amputation on her left leg. She recovered from that, back to RIC, more complications, back to the hospital. It was just our worst nightmare coming true, over and over. And here's a woman who's been through now aorta replacement surgery, amputations, a 10-year, multiple myeloma stint, and she's yelling in the ER, I don't want this. I don't want this. So that was very difficult because she had a clear DNR in place, but with all the different settings we ended up in, she signed a different DNR, or they didn't have it on file. And so each time she might have checked a box different than she did before. And I was being asked those difficult questions of, this is what we need to do, are you okay with this? Well, I'm not a doctor. Is this going to go against her DNR, or would she approve of this? Because now I can't ask her. She's not in a position to answer me. They always said, no, you're not going against the DNR. So I reluctantly said, okay, I do what you have to do then, But I could see in her eyes, and her body language, she didn't want any of it. Those extreme heroic measures done. We tried very much to honor her wishes. But we were faced with a lot of difficult decisions where we couldn't ask her opinion. My mom was just that role model of a mother everyone would wish for. She was loving and nurturing and playful, and she had strong passions for her work as a nurse. She was very involved in creating community and knowing her neighbors and being involved in our schools. And so she lived bigger than anyone I know. She packed more into a day than anyone my age. She experienced another bout with sepsis. Tests just started coming back and nothing was looking good. And once again, we're at a new hospital setting now. So we had people who didn't know us, didn't know her. And we kept hearing that she was improving. The infections were getting under control, but she never came back to us. And she was in that hospital for 5 days, and we had never seen her like that. We just kind of knew something is different here. We had somebody from hospice come and talk to us at the hospital, and she became a game changer for us. She was very skilled at having that conversation with us about the big picture. She asked my dad to take a big step back and look at the last year and all the compounding events. And did we think she was really going to get better? And we realized we needed to stop the madness, and we needed to get Mom out of there and put her in a place where we could control the environment and let her go, because we knew that's what she wanted. We moved her the next day. We had some family and friends come, and it was just the most beautiful, peaceful setting, and we had Frank Sinatra playing in the background. She died 24 hours later, one night only, I say. She was ready to go, and she died peacefully. I feel like she suffered a long time. Modern medicine gave us a lot of years with her, but in the last year, our medical system failed to address the big picture and interfered with her wishes. So I guess my feeling was that I hope that as a family we can help other people start those conversations. Don't wait until you're in a crisis, because you may not get the chance.